Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh. I'm Gursharan, Kaur, Commissioning Manager at Sunwell and West Birmingham CCG, and today we will be talking about flu and flu vaccinations. And we have Dr. Imran Zaman with us in the studio, who is our GP clinical lead and supporting the flu campaign for the CCG. Welcome, Imran.
Thank you.
We are talking about flu today because it's very important to raise awareness of the flu vaccination and the importance of it, specifically for high-risk groups who definitely must have their flu jab every year. So Imran, if you can start telling us about what is flu and how does it spread?
Yes, Gursharan. Well, flu is actually a virus which generally affects people in the nose, throat and the lungs. Most people often say, oh, I've had a flu, I've had a flu. But flu is a serious infection, or it can be a serious infection. Most people think of when they think of flu, they think of colds, and a lot of the symptoms are very similar. So most people, when they get the flu, they will start off with shivers, aches and pains, headaches, cough, runny nose, these type of symptoms. It's a very infectious illness caused by a virus called the influenza virus.
Okay.
And it usually spreads very, very quickly through communities. So often we see when one person has it in a family, a few days later it might spread to those who are a bit older or those who are coming to visit that person.
Sure.
And so it's very important that we do as much as we can to try and limit the spread of flu when people get it. Usually flu affects people during the winter period.
Okay.
So at the moment we're currently in that period. Starting from September through to March.
Okay. We're also aware that Public Health England have also launched their national campaign on flu. So there's a lot of advertising and campaigns every year on flu. But I think our local understanding from data is that the uptake is still quite low. Why might be that?
Well, there's a number of reasons. I mean, I think the first and important reason, what we're trying to do here, is to try and increase awareness.
Sure.
A lot of people are not aware that the flu vaccine is available, that it's free, and that it should be taken by all of the people who are at risk of having a serious infection or problems or complications from the flu.
Okay. You've mentioned people who are at risk. Can you tell us a bit more about which groups of people are we referring to here?
Yes. Public Health England and the NHS have said that there are a number of groups of people who are particularly at risk from having serious complications or getting very unwell from the flu. So for example, last year there was 900 or more cases of people who had to go to intensive care or HDU, which is the high dependency unit, because of serious illness caused by the flu. And in amongst that, in England and Wales, there was also nearly 100 people who actually died from the flu last year. So the people who are most at risk of having serious complications or of becoming very unwell are thought to be people who are older. So if you're above the age of 65, people who are younger than the age of 65 but might have a long-term condition. So for example, a lot of people have asthma, or they have heart problems, or they have problems with the liver or the kidneys, or they might have diabetes, or conditions where the GP is looking after them.
So it's a lifelong condition, that's what we're talking about.
A lifelong condition that we're talking about. The best thing, if you're in doubt about any of those conditions, is to speak to your GP, and they'll tell you whether or not you're eligible for this vaccination or not, and whether it's recommended for you or not. The other main groups are pregnant women and younger children. And also, if you're looking after someone who's unwell, as a carer, you're also able to have the flu vaccine as well. The other two groups are if you're in a long-term residential care, or if you're a health worker yourself, being in contact with lots of people who might have risk from serious illness if they get the flu. And these are the main groups that are at risk of having serious problems or at serious complications. Now, it's important to also realize that even if your condition is well controlled, still you're at increased risk. So even if your heart condition or your lung condition or your diabetes is quite well controlled, getting the flu jab is very good at protecting you and preventing you from having serious complications, hospital stay, and even in the worst case scenarios, more serious death.
That's as well. Well, I mean, national data highlights, isn't it, that, you know, it's a very serious condition, and really, if we can prevent it, that's what our aim should be, isn't it?
Yes.
That's the reason we are here today, talking about the importance of a flu vaccination.
Well, I think one of the important things for us to that have made us come out and do this campaign to raise awareness is that within the area, if we look, for example, in Birmingham, we can see that the kind of group of over 65s, we do manage to get quite a lot of vaccines. So we manage to get about 70% of our patients vaccinated.
Sure.
But if we look in some of the other risk groups, for example, the younger patients, or for example, the pregnant women, or the school-age children, then our vaccination rates are really quite poor.
Yes, we have some data here. So we know that last year in our Stanwell and West Birmingham area, the under 65s with long-term condition group, the uptake was only 51.8%, which is quite low than the national average target of 75%, isn't it?
Yeah,
and also,
absolutely.
like you mentioned, pregnant women, the uptake was only 38.1%. So we know that locally the uptake is quite low. So specifically talking about pregnant women now, or I think we'll come back to that as well, but why do we think the uptake is quite low in that group of women?
Well, I think that one of the things that pregnant women might be worried about is if it's going to have any effects on them. Is it safe for the baby?
Yes.
Can they take it during any time in pregnancy? So let's address some of those questions.
Okay.
Now, first of all, about the safety of the flu vaccine. The flu vaccine is perfectly safe to take at any point during pregnancy.
Sure.
So beginning, middle, end, wherever you are in the pregnancy, it's perfectly safe to take. And there's lots of data that says that it's safe for the mother and safe for the baby.
Okay.
Okay. If you look at the opposite side, women who are affected with flu during pregnancy have a higher risk of having problems themselves, but also problems with the baby.
Right,
they've got higher risk of having early delivery, premature delivery, and they've got higher risk of running into problems shortly after the baby is delivered as well.
Right, okay. So it's very important for pregnant women to have their flu jab
so
as well.
particularly for pregnant women, the message is clear that it protects you, it protects your baby, and whatever stage of pregnancy you are, it's important to get vaccinated. And the reason that vaccines have been made eligible to that group and free for that group is because it's so important for the mother and for the baby as well.
Sure. So Dr. Imran Zaman, you've talked about some of the kind of, misconceptions around flu and common cold. Can you tell us about the symptoms of flu versus common cold? So our audience is very much clear about what is flu and what could just be a cold.
Well, I think that we've all come across people who say that they've had the flu every year and I've got the flu and I've had the flu. A lot of people do confuse flu versus a less serious kind of infection. Now, the main difference is this. The flu is caused by a virus called the influenza virus.
Okay.
A lot of the symptoms are similar. People sneeze, runny nose, aches and pains. But the flu tends to be much more severe and comes on much more quickly. So most people who've had the flu, they wouldn't be able to get out of bed to go to work. They'll be kind of shivering and shaking and really, really incapacitated. Whereas with a cold, most people, they'll be able to take a box of tissues and go to work and carry on their normal kind of things. Both of the type of illnesses are, for the vast majority of people, self-limiting. So for most healthy people, they will recover absolutely fine from a cold or from a flu, and the best thing that you can do if you do get a flu, and if you're healthy and if you're otherwise well, is if you stay at home to try and prevent the condition from spreading. You use good hand hygiene, so cover your nose when you're sneezing and those type of things. Wash your hands after you've blown your nose and all of those normal health prevention type of tips. And use paracetamol or Calpol or anything that you would normally use to try and bring the aches and the pains and the fever down. And then, like I said, if you are in one of the risk groups that we've discussed earlier, then it's important that people go and speak to their GP to see if they can be protected.
Sure. Okay. So you've told us about previously also about some of the complications and how serious flu can be. What kind of potential complications can arise from catching flu?
Well, the two main types of complication come firstly from the flu itself.
Okay.
So the flu can cause the body to be weakened, and therefore other bacteria or other infections can come in on top. And often the most common complication of flu is if a bacteria goes into the lung and then causes pneumonia.
Right. Okay.
Pneumonia, as we know, is a very serious type of chest infection which often causes patients to become quite unwell. They can be in hospital and suffer from serious problems and health complaints after that. The other type of way that flu can affect people is if it makes their own conditions that they had before that get worse.
So any previous
long-term So they're long-term conditions, they're chronic conditions. So for example, people who have asthma or people who have heart disease, getting the flu might put extra strain on the lungs or extra strain on the heart, which may cause that condition to be exacerbated, to be worsened, and then people can become sick because of that as well.
Okay, so it really is best interest, or in our best interest to have the flu jab to prevent any kind of, exacerbations of existing conditions, as well as preventing the flu and pneumonia as a consequence as well.
I think one of the important things to realize about the flu is that the flu is a virus. So antibiotics can't kill the flu, okay? And the only way that we have to prevent ourselves from getting the flu is either if we avoid contact with everyone, which isn't always
really possible all the time,
or to try and get the vaccination.
Sure.
Now the vaccine is something that you put in the body which actually protects you from getting it. So it's even better than being treated, because people wouldn't even get it in the first place.
Definitely. Can you tell us a little bit more about the childhood or children's vaccination program, as it's called?
Yeah, of course. This program has been implemented for 2, 3 and this year for the first time 4 years old children as well.
Okay.
The aim of the vaccinating young children is because often children are the ones who get very unwell.
They do, from school
and
nurseries,
they have problems, exactly,
Yeah.
can't go to nursery and suffering from that way. The other thing with children is often we find children do spread the flu as well, because whereas you or I might know to kind of cover your nose or wash your hands,
yeah.
often it's much more difficult for children, and they're much more kind of
running around,
all over the place, running and so it's much more difficult. And therefore, by targeting some of these groups, we can try and prevent the spread of it. Now, the flu for a vaccine for children is slightly different to adults.
Oh, okay.
In adults, it's given by an injection, and normally in children, it's given by a spray.
Right, okay.
Now, the spray is a very, very effective type of vaccination. Actually, it's more effective than the injection.
Okay.
And it's a very, very safe type of medication. It's been given for more than 10 years in the United States of America, and they've got very, very good data to say that it's very safe and very, very effective for children. The flu vaccination for children is, like I say, a spray, which means that they don't get worried, they don't get scared. It's much easier to give for children, and so it's a very safe, very effective way of giving it to children. And as I say, it's eligible to children who are aged 2 and 3, and this year to those children who are aged 4 as well.
Okay.
Now, just one thing that I would like to stress is that that's for all children, including healthy children.
Right, okay.
All of the other children who do have long-term conditions are also eligible for flu vaccine. And those children under the age of 18 can also see their GP and would be given it. But for example, if you're 6 or 7 or 8, then they may only be eligible if they have a long-term condition. Whereas for 2, 3 and 4-year-olds, all 2, 3 and 4-year-olds are eligible.
So by default, really, 2, 3 and 4-year-olds are eligible for the flu jab.
That's right.
So the parents must make sure that they contact the GP practice
Yes.
to make their child's appointment for the flu jab.
Yes, yeah,
Okay,
yeah.
thank you for that. You've mentioned that the vaccine is safe, and there's a lot of data from US as well that highlights and confirms that the vaccine is safe. Is there any side effects at all for the childhood vaccination as well as the adult vaccination as well?
Yeah, so if we've been talking about the childhood vaccination, so if we take that one first, the childhood vaccination is via a spray, a nose spray. And the most common side effect of that is a bit of a runny nose or a watery nose afterwards. The child vaccine is actually very well tolerated, and normally children don't have very many side effects with it.
Okay.
The one thing to mention with the childhood vaccination is that for some religious groups, they should be aware that it is made with pork rind products.
Right, okay.
And so obviously there is some kind of debate that some people have in certain groups about whether or not that's acceptable. But other than that, it is a very, very well tolerated, very, very good vaccine with very, very few side effects. With regards to the adults who get vaccinated, the most common side effect is to have a bit of soreness where you have an injection. It's an injection.
Yeah, it's expected.
And so that's expected. And sometimes it can cause you to have a little bit of aches and pains, as though you were going to get a very, very mild flu. Usually that's very mild, and it's important to note that the vaccine, the injection, does not give you the flu.
Right, okay.
And it cannot give you the flu because the vaccine itself doesn't contain the virus, doesn't contain live virus. It just contains things which will help your immune system to become stronger and to fight the virus.
Sure.
So a lot of the time people are worried that, oh, if I take the vaccine, will it give me the flu? It can't give you the flu.
Right, okay. So, I mean, those side effects, very, very mild side effects, as you mentioned, are not to be confused with the actual flu, isn't it? The flu virus.
Exactly.
Even though it might be a runny nose or a little bit of a cold, but really it's not the full
It's
flu.
usually very mild, usually very short-lived, and like I say, those symptoms are often only a very mild kind of day or so's worth of illness.
So we know, we talked about data earlier as well, and we know that locally, Sandwell, West Birmingham, our uptake is quite low. So what else can be done to actually increase the uptake, as we are today talking about flu and the flu vaccination, raising awareness with our local audience as well? What other kind of activities could be organised locally?
Well, I think that there are a number of things that we can do. I mean, the first thing I think is for those people who are concerned or who think they might be eligible, the flu vaccine is free because you need it. Okay, so the safest or the best approach is to contact your GP. From the beginning of October, most GPs will have their flus ready, and then they will be able to tell them whether or not they can book in for a clinic or have that injection given. Once if people get that done themselves, then they can also help by contacting or by encouraging other people in their family who they think that they might be vulnerable as well. So for example, if there's someone in the household who's over 65, if someone in the household has asthma, if someone in the household is pregnant but they didn't know they could get the flu vaccine, or if there are children, then again, just letting them know that, oh, did you get your flu vaccine? Or just talking a little bit about
really,
it might help to improve it.
Okay.
And there are a number of other outlets, there are a number of other campaigns. Again, you talked a bit at the beginning about us linking in with the Public Health England campaign, and there is a campaign on NetMums and on the national media, again, which is promoting the flu vaccine, which is trying to encourage people to go and get their vaccines and to kind of just generally make sure that everyone knows about it and everyone can get it done quickly, safely and in time to prevent them from getting serious or severe complications which the flu can bring.
Sure, thanks for that. You mentioned earlier, Dr. Imran, that there is these high-risk groups that are eligible for the flu vaccination. Do they automatically receive an appointment letter from their GP practice, or do they have to contact the practice? How does that work?
Well, the practice of how they are contacted varies a little bit.
Sure.
For the vast majority of people who have a condition a long-term condition, they do have their name on a register,
Okay.
and they will be called or invited into a flu clinic.
Okay.
Okay. But my advice would be not to wait necessarily for that letter to come. The earlier you get it, the better it is, because you'll be protected for longer.
Right.
So if you get it right at the beginning of the season, then you'll be protected from the flu throughout the whole season. Whereas by the time you get round to doing it, you might have already had the flu. So it's better, as soon as you can, as soon as you know you're eligible, be proactive, contact your GP, and try and get booked in for your flu vaccination.
That's the key message really then, isn't it? Don't wait for your appointment to come really. I mean, it will come, it might come later though.
Yeah.
So it's really, you know, to take the onus on yourself and take that responsibility on yourself to make the appointment yourself early on in the flu season.
Absolutely.
So it's actually the vaccinations have been delivered now, and the GPs are running the flu clinics now, isn't it?
Well, as I say, the flu season usually extends from about September to March.
Okay.
And most practices should have had their flu jabs delivered, and if they haven't, then they'll be able to tell you when their clinics will start. And so if you contact, then you'll be able to be at the front of the queue when they do start to deliver those injections.
Okay, so locally we've talked about data, national and local as well. So I just wanted to capture and highlight really that we had 1,694 patients last year in our local area affected by viral pneumonia as a complication, you know, due to flu. Viral pneumonia related hospital admissions. The cost of the local NHS 4.6 million. It's extortionate amount of money,
amazing,
isn't it?
When you speak to people, often they don't kind of often we don't take flu so seriously because everyone kind of
it doesn't seem like a serious condition, does it? But when we look at the stats and the data, it really highlights that it is a very serious condition. It can be fatal for people as well.
Yeah, and I think that the really important message is that because it can be serious and because it can affect people in that way, it's such a shame if people do become unwell, because we have a vaccine that can help to prevent it. So it seems to be a bit nonsense if you kind of if you don't get it. It would be kind of like driving around without a seatbelt, which people used to do years ago, and getting flung out of the car, and then people say, "Oh, well, why didn't you wear your seatbelt?" Well, it's the same kind of thing.
It's there for a reason, isn't it?
If you end up getting very, very unwell because you've had an infection like this, well, there's been something there that you can take that will prevent that from getting bad. I mean, from my own personal experience as a GP, I've seen a number of patients who have become very, very unwell.
Right. Okay.
And you know, one patient who I remember who just came in with what seemed like a cold, and then it just kind of got worse and worse. She was a pregnant lady, ended up having to go into hospital and spending quite some time in intensive care unit, which meant that she missed out on the birth of her child, on those precious years. She was very unwell, the child was unwell, and it ended up turning into a situation which was very, very unsavory, which can be prevented by a simple flu injection. And I think that's really the message that we're trying to get out, to raise awareness of the fact that the flu is different from a cold. It's a bit more serious. And it's very, very easily spread, and so the most effective way that we have to prevent that spread and to try and prevent people from having serious complications, including in the worst case scenario, people dying from this illness, is for us to promote the vaccine, for us to get the vaccine done early, and for us to get the message out to all those people, particularly those people who are at risk, that they should have the vaccine. Now, I do just want to kind of add a little bit of information about people who shouldn't have the vaccine, or people in whom it might be a little bit
who might be at risk, really. There's always a risk group, isn't it, as well?
Yeah, so the main types of people who need to be careful with the vaccine are anyone who's had a previous reaction to the vaccine, and obviously they should consult their GP about what to do this year, and anyone who has a serious allergic reaction to eggs or egg products.
Right, okay.
There are ways that we can get around that. There are certain vaccines which don't contain those products, and there are also certain vaccines which only contain really minuscule amounts of those.
Sure.
But those type of people should, again, seek the GP's advice about what to do next and where to go with that.
Absolutely. I think that's one of the key messages from our conversation today, isn't it? If you're not sure, speak to your GP and, you know, practice, and they'll be able to advise you on what's appropriate for your specific condition. So we know that nationally, over a quarter of UK population, that's 15.4 million people who have long-term condition. Dr. Imran's explained to us long-term conditions, any lifelong condition so you might have or a child might have.
Yeah.
What's one key message, Dr. Imran, you might want to give to that cohort of people? That's a huge number of people who are eligible for the vaccination and who are actually at risk from the flu as well. What's one thing you would want to
the key message that I'd like to give to that group of people is, don't put off your flu vaccination. Try and get it done as soon as possible. It's free because you need it.
You need it, definitely.
The importance of the vaccine is really in targeting those people who are vulnerable, who are at risk, and it will and it has been shown to prevent serious illness and complications. And again, if you have a long-term condition, even if it's well controlled, it's important to get the flu vaccination. And even if you've had the injection last year, it's important to get the vaccination again this year, because every year the type of flu that's out there is slightly different.
Sure.
And the injection that we give is targeted to that particular one that's around at that particular year.
So every year all the patients in these high-risk groups must have the flu vaccination, isn't it?
Yeah, that's right.
The message,
that's the message.
One key message for pregnant women category as well?
Again, my key message for people in or pregnant women would be that the flu vaccine is safe for them, it's safe for baby, it's safe to be taken at any time during the pregnancy, and I would recommend all pregnant women to again go out and get it as soon as possible. They're included in the eligibility because again it's very important to make sure that they have it to prevent risk to themselves and to their babies.
I think a couple of key messages we're giving today is that if you're eligible, get your flu jab, and it's free because you need it really. That's the reason it's free on the NHS. Thank you very much, Dr. Imran, to talking to us today about the flu and the importance of flu vaccination. If you have any more questions that you would like to ask Dr. Imran or contact the CCG, you can contact us on 0121 500 1500. Thank you very much for joining us today. Vaheguru Ji Ka Khalsa, Vaheguru Ji Ki Fateh.